Hi, welcome to an information webinar with Generali Pan-Europe on the topic of mental health and well-being for employees. My name is Shane Martin and I'm a business development consultant with Generali Pan-Europe. Our guest specialist is Dr. Ian Gargan. Ian is a clinical director at Imagine Health. Imagine Health provides psychology and well-being services to GP services and primary healthcare centres around Ireland. They also provide services to the direct clients. They also work with a number of employers in the area of education and promotion of health and well-being of their employees, as well as carrying out individual face-to-face services with members as they require it. The discussion today will explore areas of how companies, both global and domestic companies, can take action to prevent and manage the well-being and mental stress within their organisations, and look at ways at how companies can promote a healthier working environment. Can I start off by asking how you can maybe provide an insight into work-related emotional well-beings that you're experiencing and some of the statistics and trends that you're noticing?
Thanks, Shane. Yes, myself and Imagine Health, see a lot of work-related stress issues, both on a one-to-one or within organisations.
Yeah.
And that comes in the form of anxiety or depression or just general unhappiness and dissatisfaction. Also like poor contentment with the workplace, but very often it's coming from home or coming from other areas of their lives, that when they're at work, the stress levels go up because they're less capable of being so robust when they're under pressure of having to do their job also.
Yeah.
Statistics show now that there's an increase in work-related stress and organisational discontentment worldwide. The World Health Organization have done a number of studies, and they say by 2021 it'll be the biggest source and reason for absenteeism, poor productivity, and recruitment costs. And it'll take over from lower back pain, which it is at the moment. So it's a very pertinent issue of the time. I think also within Ireland and other countries, mental health and emotional well-being, or whatever you prefer to call it, is becoming far more pervasive than people's lips. So it's talked about more and people are far more aware of it. As a result of that, people are demanding more of their employer in terms of their mental well-being.
And are employers in Ireland, are they noticing that some of these trends and statistics are having a knock-on effect in terms of their productivity and, I suppose, the efficiency of the organisations? Is that a concern for them?
It is a concern for them. I think when costs have been so high in the last few years and people are very much focused on, the specifics of what they're paying out for or what they can afford, it's become far clearer that any little thing can make employees much more unhappy. If there have been salary cuts and people are less resilient in the workplace, then they find that they're struggling more with their mental worth, as it were. And while they're delighted, a lot of people, to have a job, they want that job to be something that means a lot to their life. So they, what happens in their life gets brought to their job and vice versa. So they have a more vested interest probably in their employment and job now because it's become far more precious. If they don't feel happy in the workplace, then they might reluctantly do so, but they will become less interested, demotivated, not be as productive, or just not turn up.
Okay. And in terms of, I suppose, what are some of the main causes of stress or work-related stress? I suppose maybe looking at maybe the causes inside the workplace, but also maybe some of the external causes that maybe actually people are bringing into the workplace with them.
Yeah. I think the internal causes would be usually working relationships is the main one, how they're getting on with their co-workers or their manager or even just the environment. Also that the workload is high and they don't feel able to cope with it. And usually that's just a matter of organisation and them perceiving supports to be around them. It's very simple solution to that problem. The social factors would be relationship difficulties outside in the home, or problems with the family, or even just financial stresses, which is very common at the moment, that they're bringing into work and trying to find that solution in work, that even if I work harder or if I can get up the line quicker or become a more senior employee, it might help with the finance, but it's not coming from the right place where they want to do it. It's almost coming from a pressure that they have to.
And in terms of some of the areas, so if you have an employer who actually wants to be proactive at this space, what are some of the early signs or trends that they can actually maybe identify or they can partake with some of their managers to kind of look out for it, to see if spot early symptoms in terms of work-related stress in their employees.
Yeah, I think it's important, Shane, to understand that education is the key, like it always is, with managers or with employees. It's not about saying, oh, we just need to get some therapists or some psychologists in and fix the problem. It's more about people identifying normally that I'm not the only one who has this problem, and it's actually really common, and I can solve it. Like, so what we like to do, and what many practitioners are doing now, is educating managers who have a wider view of the company, who get to see trends more than the person who's just working in, maybe a siloed space. And the earlier trends are where someone socially withdraws, they become quieter, the mood changes, it's a lower mood, their productivity or their happiness levels don't seem to be the same as they were. What I often say to managers is, if you think there's something wrong, there is something wrong. If it crosses your mind, there is, because they get to know their employees so well and their co-workers over a number of months and years, that if there's a change in a trend or just something very subtle, then it's usually indicative of something bigger, and that's when it can be addressed before it becomes something far more oppositional.
Okay, and so the early intervention is key in that respect. And I suppose from what steps could employer take if they notice that somebody maybe is becoming withdrawn, or a particular group within their organisation, they're actually finding that the morale is low, and that's actually leading to work-related, I suppose, stress and maybe a trend in absenteeism. What are some of those early steps that they can take, maybe in terms of areas of prevention?
Well, looking at the environment in which people are working in is very important. So making sure that it's a comfortable environment. We've heard about ergonomics and comfortable chairs for years, but this is actually maybe a little bit bigger. So just colour schemes and space that they have in their environment. Our environment is so important to how we feel. That's something to look at as a preventative measure. Secondly is education, where you have, you're decreasing the boundaries and promoting accessibility to kind of different services. So you're saying to them, you have a speaker series. People come in and have a light-hearted approach to maybe how to sleep better, how to manage work-related stress, how to get more out of your daily work and organise it, and like really how it reflects your personality and really enhance that feeling while at work. So you have a speaker series. People then see those individuals or speakers talking, and they feel comfortable with, that seems like a nice psychologist or a nice doctor, and I might have a bit of a problem, or I want to talk to him about something. Then next thing you might offer is drop-in clinic. So it could be just a 15 or 20 minute consultancy, and then after that you may have an employer might decide to have one day every so often, or a week, or whatever it is, of on-site therapeutic services or counselling, or an access to off-site work. What we find too is it's very important to have client or employee alliance. So you might just have a speaker series and then offer them email access to different professionals to say, if you have a question, if you're wondering about is this unusual, or if you're feeling a bit weird, drop us a line. So that's, I really think that the best things that employers can do is to kind of start off by having just a very robust, frank conversation about something that's lighter in mental health. It doesn't have to be too serious, and then move on from that as they see fit.
Can you give an example of some of the tools that some employers maybe can give to their employees to help manage their own health, and maybe make them aware of the promotion of good, healthy mental well-being?
I think employers often think it's a mystery of what psychologists or psychiatrists or doctors do in a room to talk to a patient. Very often it's based on a lot of training, but it's also in really actively listening to what the individual needs are. But some of the programs are very specific. So for instance, there's promotion of say 4 a day, like your 5 a day of fruit and veg. 4 a day is you pick 3 or 4 things in a day that you like to do, whether it's like take a walk at lunchtime, go for a run, eat something that you like, or meet someone that you want. Very discernible things that you can do in a given day to boost your morale, whether you're conscious of it or not. It'll make you feel better. So arming your employees with 4 a day, that's one thing. Also you can teach them and train them to have a wellness toolbox. Just various things that you go to when I'm feeling a bit low, or actually I just like to feel a little bit better today. So that could be, anything that you do in your private life as well as professional life. And it's usually based in something that boosts their humor. Or like it can be something associated with music. Or it could be just even meeting people and talking to them. We're very social beings, and we find that once we talk to other individuals, we feel better. So that there are two programs that we promote, or psychologists promote, that are very simple to put in place, and they're something that you can almost have as a picture graph in a person's office where they know they can go to and look at. So even when they're feeling vulnerable, they actually think that this is a fairly simple solution.
Yeah. And so that's, as I mentioned, say for instance in Generali Pan Europe, we would have companies that would range from 10 to 20 employees up to companies that have over 5,000 employees. And I suppose the budget size is quite significantly different for those different companies. But there are some of the tools maybe that some companies with relatively low budgets can actually implement to promote a healthier workforce for their employees.
Yeah, I think it's very important to remember that for employers, the change that happens in culture happens within one person and then spreads.
Yeah.
Aiming something with the words of what they already know about all their lives.
Yeah.
So it's kind of very often when we talk to patients, they say, "Oh, is that all it is, or is that all I have to do?"
Yeah.
That doesn't seem that difficult.
Yeah.
And you can say, "Look, that it isn't difficult at all, and you have all the skills to be able to put that in place in your daily life." You started with 1 or 2 or 10 people, and it just becomes a water cooler moment, a conversation piece where it spreads then throughout the culture. So actually, the smaller everything we do starts on a small scale and grows to bigger. So no matter how big the company is, it always starts with the 20 or 30 or 40 people and then moves bigger.
Okay. And if a company, I suppose, is approaching this, and maybe for some clients of some of the partners that we have, if they're looking at areas where, I suppose they've thought about this area, we want to actually do something in this space, but I suppose they want to look at areas of how they might be able to assess how the mental health of their actual organisation is. Is there things they can look at that will help them assess, I suppose, get analytical data in terms of how healthy their actual workforce is, or what the morale is like in their workforce?
Yeah, there's the HR departments can either do it themselves, or they can talk with mental health professionals, or even doctors who use these outcome measures and assessment tools all the time. So for instance, there's the iHowQ, which is like a questionnaire. I think it's freely available on the internet, and it shows, it's a general health and well-being questionnaire. And you could start by administering that to a couple of your key managers, and then looking at it again maybe in a month or 2 months and seeing if there's a shift. But in the meantime, maybe offering something to cause a shift. There's one thing that is very important when you're starting a mental well-being program, or if you're bringing people in to devolve that service or support their managers, is to know what you think success will look like. So if 3 months and 6 months you feel like there's a better attitude among your employees, or if the absenteeism has decreased, if your productivity's gone up, or just recruitment levels happen to have to be so busy, then that's what you should be putting down and talking with the mental health professional about, like, that's what I want to happen. And so what you want to happen is helps the person govern what programs should be put in place.
And that may be some of those tools you mentioned there are some of the areas where they can actually measure the effectiveness of how successful the initiatives they've actually put in place are. Yes,
and I think that more and more it shouldn't be a mystery of what the facilitators are doing with the employees. It's massive integration to the actual organisation culture has to happen, and real transparency. So you're talking about the programs you're offering the employees, you're talking about the specific modalities and methods you're using, the qualifications of the people who are providing them, and then you're saying there's going to be a quarterly report and they're going to have these headings, does that suit you? Also, I think a lot of employers like to hear from the mental health professionals or the clinical workers or whatever you want to call them, anecdotal stories of what's going on in the workplace. So while you wouldn't go into specifics of any cases, of course, because of confidentiality, you might say that we're hearing a lot from your employers that they don't feel listened to, or employees, they don't feel listened to, don't feel like we're able to talk to their managers, or more often than not, they're actually just finding things very difficult at home, and coming to work is a place where they find some solace, but they're not really getting everything out of that solace that they'd like. So it's even just, it's an candid information imparting zone, as it were, where everyone feels that they're just getting a better clue about what's going on for the employees.
And in some areas where, I suppose, some companies, with the best of intentions, they're, I suppose, conscious of mental health and well-being of their employees, but inevitably they may get some employees that may need a specific treatment in regard to, and may need some period of time where they are absent from work. What can, I suppose, the mental health area offer in terms of reintegrating people back into the workforce, and what is best practice to make sure that, I suppose, they're ready to go back to work and that it's a sustainable return to work?
The best practice would be that, first of all, I suppose the phase of them returning to work is a slow and transitioned one.
Okay.
Also, that they be assessed by a occupational health specialist,
right,
whether that be a psychologist or more often than not a psychiatrist.
Yeah.
That's quite a comprehensive assessment.
Okay.
Then with that, the employee works closely with that medical professional to address what maybe some of the problems are that are preventing the clear for them to go back to work. When they're given the clear to go back to work by working with their professional and, by the way, their manager or person in-house, which is really important to keep that line of communication open, then best practice after that would be to have someone to go in and to talk to the group about their own mental well-being.
Yeah.
Because very often something that prohibits the return to work being as successful as it could be is that people at work are very nervous about the person coming back, and they're not sure about what they should talk like or how they should
address it.
So being open about that and chatting to them about not what to look for or just take care of your coworker is also something that's very useful. Okay. When they go back to work, then the employee goes back maybe a month, 3 month, 6 month, and a year follow up, where you're just making sure that they're out of the woods and they're feeling far better, more robust, and back to normal in the workplace too.
So Ian, some companies may feel that they're okay in this area, that they don't have a problem in this area, and that it hasn't come up as an issue for them. What actions do you think that some of these companies should be taking, both for their employees and the workforce, and I suppose in terms of helping them in society in general?
Yeah, that's an excellent point, Shane. Really, it's great that some companies don't think that there is questions over their organisational culture or the well-being of their employees, and that's superb. What we're always promoting is the workplace shouldn't be just good enough, it should be excellent. Yeah. People should really want to be there. They spend the majority of their lives there. Yeah. So it should be a superb space. 1 in 4 people have a question at some point in their lives about their mental health, and that's nothing to do with their work. That's just what turns up to GPs every day of the week. Yeah. So statistically in your company there are people who are having those questions and asking them, and you could be addressing them even though you don't know that they have a problem, by having the speaker series or by having particular days or group events that promote happiness or contentment in what is already you perceive a good workforce, but it'll just notch it up another level to make it excellent. Yeah,
and again that's an element of prevention in there as well, where they don't have a problem today, but it's going to prevent maybe some issues that may come down the track for them.
Exactly, and if something does come up, or even if there is something difficult that happens environmentally to the company, they know that those services have been provided all the time before it happened. So it's not like damage control or crisis management then. It's a very seamless move into going to the right people to get added help when the company might be going through such a difficult time.
Great. Well, I think, thank you very much. I think a lot of the topics we've touched on there have been really thought-provoking. I hope our partners in business have actually found it really useful, and maybe they may have some clients that maybe recognise some of the situations that you've actually identified there, where services and the information that you've parted with us today actually could be very useful. As Generali Pan-Europe, we obviously have a very keen interest in ensuring that companies are actually promoting mental health and positive well-being within their organisations, and we will do what we can to try and support that. So thank you for your information today and your expert views, and we really appreciate it.
Thank you very much. It's a pleasure.